So the idea is a good one, and that's that at the beginning of an epidemic, we really want to be sure of the results. And so the CDC wanted to essentially take control and distribute testing kits to trusted laboratories, those of our state laboratories, as well as the laboratory at the CDC, to really be responsible for performing the tests. So the idea is very good, but at the same time, we want to. It ironically sort of also limited the amount of testing that could be performed within the country, and really prevents hundreds or thousands of different laboratories with capacity to actually be able to perform the test by really trying to have a little bit of maybe too much oversight over how the test is being performed. And in this case, I think it's a little bit of allowing the perfect to be the enemy of the good.
Are there patients that you think you and your colleagues there in Boston should be testing now? And could you be testing them now if you were allowed to? And then a third question, if you were allowed then to test them, do you think we would turn up more cases like we're seeing in California?
Yeah, so I think there are, essentially, if there's respiratory cases occurring in the United States at the moment, and they turn out to be flu negative, so they're negative for a lot of the regular respiratory viruses that we test for, we probably should be testing them at this point for this coronavirus. And that's because we don't know where the virus is circulating. And I think that the patient in California is a good example of how, unless we're testing and checking, we just don't know what's circulating in the community. And so there are patients throughout the whole country that probably should be being tested. And I actually think, to take that a step further, we should actually be extending testing, maybe not only to just patients coming in, but maybe even testing hospital staff and employees, and maybe going to, doing more of a surveillance effort to also be looking for this virus would be optimal from a public health and a clinical perspective.